How many Australians are fully vaccinated, that is, have had 2 doses of a COVID vaccine?
At this point, we've had about 500,000, and that's out of a vaccination population of 3.9 million. And the reason is very simple. The AstraZeneca vaccine is a 12-week period between first and second doses, and that's been the primary vaccine in Australia. And as one of your predecessors or one of the previous speakers, Mark Butler, said, we follow the medical advice on that. So that's similar to what's been in place in the United Kingdom. That's allowed more people to be vaccinated earlier, but it's also the optimal dosing time for the principal vaccine in Australia.
That's 500,000 Australians who are fully vaccinated out of a population of 26 million. The US announced this week that they have got 50% of their population completely done. Australia's performance is underwhelming on any measure.
Well, with great respect, today was a record day of 111,000 Australians who stepped forward to be vaccinated. 3.9 million, 3,906,000 Australians who've been vaccinated.
Come on, Minister, 500,000 in total. That's nowhere near half the population like the US has, is it?
I would respectfully make the point that to indicate that a first vaccination is not a fundamental and critically important protection would be, I think, a very unfortunate
True, but if it was full vaccination,
leave.
It'd be full vaccination, right?
No, with great respect. What we see is that we have very significant protection from a first vaccination. The principal vaccine in Australia that's being used is the AstraZeneca vaccine. That works on a 12-week turnaround. The Pfizer vaccine has a 3-week second dose. Approximately 500,000 Australians have been vaccinated with that. And next week is the first week after the AstraZeneca vaccine reaches the second dosing point. So what you'll see from next week is a progressive increase in the number of Australians to have second doses, entirely in line with the medical advice, entirely in line with the fact that the more Australians you can vaccinate earlier, the optimal outcome for Australians. And so Australians are stepping forward, and I want to thank them. There were record numbers in each of the last 3 weeks. This week we've had 2 record days in a row. It's likely we'll have a record week, but we want to encourage more to come forward for safe and effective vaccination.
Let's talk about the protection of Australians in aged care. Let me read to you from a press release you issued on the 16th of February. It's anticipated the rollout to aged care facilities will take approximately 6 weeks, so by March the 30th. And then today we learn, only because of the COVID outbreak, but that there were this week 29 aged care facilities in Victoria that had not been vaccinated. Whose head's going to roll for that, yours or the Aged Care Minister, Richard Colbeck?
Well, with great respect, we have 98% of facilities around Australia in a program that is protecting Australians. For example, there was a case amongst a contractor in the TriCare facility on Mermaid Beach.
Can you just address what I'm talking to you about?
The residents had all been done.
Minister, we've established, so you've said 98%. So how many, in actual numbers, how many facilities does that mean around the country in Australia, aged care facilities, have not had vaccination yet in an actual number?
In Victoria, we have 9 to complete tomorrow. Victoria's actually at almost 99%. And around Australia, prior to today, because we haven't had today's figures come in, we had 74 still to go. But today there will have been significant numbers.
74 still to go. You said on the 16th of February that it would take 6 weeks. We know these are the most vulnerable people in the country based on the deaths data that we saw last year. How can 74 places not have been vaccinated yet?
Well, with great respect, we've had 98% around Australia, almost 99% in Victoria, and in some cases they had issues such as whether it's a gastro outbreak or they had the flu vaccine. As you noted in your discussion with Dr Chris Moy, given the epidemiological situation in Victoria, the Chief Medical Officer, after consulting with the Australian Technical Advisory Group in Immunisation, has been able to bring forward the period for in between the flu vaccine and the doses which are now to be given tomorrow. And so by tomorrow we expect that all of those facilities, subject to no incidents occurring, but all of those facilities in Victoria. So
let me read to you again. Let me read to you
about
some
a 99
more.
or a 98%
I'm not quibbling.
rate
I'm speaking
so
on behalf of the families and the residents of the 74 facilities that you've just revealed. Let me read to you from that same. Let me read to you from that same.
100% within the city of Whittlesea, which is the epicentre, and they've all
but as we know, COVID can spread. That's why
and
states have locked
second
their
doses.
borders. Let me read to you from that same press release. This Minister for Senior Australians and Aged Care Services, Richard Colbeck, said the Australian government would be responsible for leading the implementation of the COVID-19 vaccine program in the aged care sector. So if COVID now rips through an unvaccinated aged care facility, that's on you or Minister Colbeck, right?
Well, it's 99% completed, 100% tomorrow, 98%
But
around Australia.
Who's responsible if that happens?
Well, this is absolutely the Australian government, and the fact that we have achieved across Australia well over 300,000 vaccinations in an incredibly difficult situation where care and attention needs to be given to each resident, where there's an in-reach team that comes in, where all of those elements have been negotiated and achieved a 99% outcome in Victoria, a 98% outcome around Australia, with the others to be completed tomorrow.
Okay.
In Victoria, I think is
we run out of time,
an immensely important protection for Australians. And
it is.
that's what we're doing. We're
before
protecting
we run out of
Australians.
time,
I would say this, Lee.
Minister,
in a world of 500, 600,000 cases a day, we've had 94 days of zero cases in Australia. So we know how to get through this. We'll get through it again. It is
Minister,
a very difficult time, but we'll keep fighting to protect people.
What we know that we need to get through this is quarantine. Every recent COVID outbreak we've seen has come from an urban quarantine facility. None of them have come from the facility at Howard Springs.
That is an urban facility.
Isn't it a no-brainer to increase capacity there or to build another like it?
And we've done that.
But
the Howard Springs capacity has
further.
The Howard Springs capacity has been increased to 2,000, which is, on all the medical advice, the maximum of its capability.
Well, then what about building another like it?
Well, how long would you expect that would take?
Well, when are you going to make an announcement that you're doing that?
But what we have to do is bring Australians home now and prepare for the medium term, as was mentioned by Chris Moy. We're doing both of those things. We've already put in place Howard Springs, expanded that to 2,000. It's an urban facility. Sometimes it's presented by some as if it's not.
It's not downtown Sydney or Melbourne.
I've been there on 2 occasions. I would be respectful to the people of Darwin.
The people of Darwin know that they don't have the population size of Sydney or Melbourne, Minister.
Well, we met with the people, Brendan Murphy and I, when we were bringing Australians home to Howard Springs in February of last year. They had just the same concerns as people of Melbourne or Sydney. They have just the same rights as people of Melbourne or Sydney. And there's also an Indigenous population, which is a vulnerable population. So that facility, which has been Commonwealth run, has produced 100% protection, but the Northern Territory has now taken it over. Around the country, what we see is that the states and territories have done an outstanding job by any global comparison. That's what's protected us. That's our first line, but it's not our last line. And so this notion that there will never be a case from overseas, I think is one which we always have to test. We've done better than anybody else in keeping cases out. We've seen Singapore, Thailand, Taiwan, South Korea, Japan, outstanding countries that are all dealing with outbreaks in a global pandemic. We're keeping it out better than almost anybody else, but we're always fighting to do more.
Minister.
And so we're always looking to expand on those protections. We'll get through it. It's difficult days for Victoria, but we'll get through it.
Minister, thank you for your time this evening.
Thanks, Lee.
Hi, I'm Lee Sales. Thanks for watching this story. If you'd like to watch more of 7:30's stories, they are on the left of your screen. And tap on the button below to subscribe and get the latest from ABC News.